So question one. So question one submitted to me by Dr. Mjad, who submitted me 5 questions to address, and the first 5 videos will be addressing those specific questions raised by him. I will try to make it concise because there is so much information for each question. But in question one, Dr. Mjad asks, how and when should we start treatment in de novo Parkinson's disease patients? So really, if you unpack it, there are 2 important questions here. One is, when should a treatment be started for Parkinson's disease? And the second one is, how should a treatment be started for Parkinson's disease? And that really is a large topic, what we call management of early Parkinson's disease. So I will try to make it very concise and brief, although there is so much information here that I could go on to. So what's the bottom line? What is it, that 1-minute answer that I can give? In terms of when should treatment be started for Parkinson's disease patient, the answer is simple. It should be started when there is enough symptoms that it impairs patients' functions or activities, whether it be at work or whether it be at home. We know that all the treatments we have so far for Parkinson's disease are all symptomatic therapies. They make symptoms better, they make patients have less tremors, move better, have less rigidity, have more dexterity, be able to get tasks done, things done sooner and faster and quicker. So if they're slowing down, if they're slowing down at work, if they're slowing down at home, not able to do things well enough to a point they're bothered by it, then you should consider starting treatment. So I may have someone who's 75, is retired, is at home, has quite a bit of a tremor, but is not bothered by it, is not embarrassed by it, can go out and eat in public, can socialize with his friends. He doesn't want any treatment, and I'm fine with that. He doesn't have to be on any treatment. And compared to someone who is a high-functioning executive, has a little bit of a tremor and some slowing, but it really slows him down in the meetings, or is embarrassed by looking weak by having that one little tremor show up in their hand, and wants to be treated right now so that he can keep functioning at the same level and not have to step back or reduce his assignments, then I will start the treatment of that patient. The point is that we have good effective symptomatic therapy that can control symptoms, so we should control symptoms that are bothersome to the patients and not worry about the details too much, although there are some details about it that could be discussed later on. The second half of the question, how should the treatment be started, is even more difficult to answer. And although there are a lot of details and debates on different types of medication like amantadine, Symptomatic or carbidopa-levodopa, and dopamine agonists, pros and cons and things like that, I think bottom line is that the treatment should be started with something that will provide enough relief to the patient, and not necessarily more than what he needs, and not necessarily with side effects. So I am not sure in the long run it matter too much if you start with dopamine agonist, or if you start with levodopa, or if you start with amantadine, as long as you were able to provide the relief to the symptoms. You have to be mindful of how much relief can you give with each medication. And some are more powerful than others, some are more stronger than others, some are more longer lasting. I think the simplest answer is just start with levodopa, carbidopa, levodopa, Symptomatic. There is so much debate around it, but the bottom line is that it's not toxic, it doesn't hurt, there's too much details about it that I can tell, so many trials I can point out. But in the end, levodopa is highly effective, levodopa is very useful, it's very safe, it's non-toxic. It will provide a good relief to the patient. Just start with it, and then you can use other medications as adjuncts, as its replacement whenever necessary. Now, of course, there will be situations where you not just automatically go for levodopa and based on patient preferences, something that struck you, your own personal biases, that's fine probably, as long as you're controlling the symptom. That first medication you have to prescribe is not a big deal. Just use levodopa, I think.